Hello and welcome to 18 WJTS in.form. I'm Kaitlyn Neukam, and it is, we've got the turn of the seasons, in and out, annual things, all kinds of fall activities, but more specifically, we have SHIP that is coming, it is enrollment time right now and all of that stuff. So with that, we have the wonderful Melanie Garland, the volunteer supervisor for Southwest Indiana's SHIP program with us today. So welcome.
Thanks for having me. Yes.
It's been a year since we saw you last, so
yes.
Full rotation, and now you're back to talk about some more information that everyone kind of needs a little bit of knowledge on.
That's right, yes. So a lot of folks, when they think of fall, they think, pumpkin spice and the holidays coming up and the turn of the seasons, like you said. But at SHIP, we think about Medicare because it is the annual open enrollment period. And that is the time where anyone that's currently on Medicare can make changes to some of their plans for next year. So it's our busy season, but it's kind of our favorite season too.
So what does SHIP stand for?
Absolutely. So SHIP is the State Health Insurance Assistance Program. So here in Indiana, we are provided through Indiana's Department of Insurance, and our whole mission is to be a free, impartial resource for those that are on Medicare to understand their Medicare options, understand their coverage. If they have questions about their plans or even a billing question, we can help with all of those things. And impartial is the key word there. We're impartial on purpose so that we can be that true, unbiased resource for folks to where they can turn to us, and we're not linked to any insurance companies or brokering agencies.
So as a young person who has had to do some wonderful tech support with someone who's, looking for insurance, blah, blah, blah.
Right.
What's the difference between Medicare and Medicaid?
Oh, yeah, that's a big one. So, Medicare is for three groups of people. So you want to think over the age of 65. Folks that are on Social Security disability for over 24 months, they are also eligible for Medicare. And then some folks that have been diagnosed, the main one is the end-stage renal disease diagnosis that you can qualify for Medicare. So enrollment goes through Social Security for Medicare, and it is a nationwide program, so it's federally ran, okay? And then with Medicaid, it is state ran. And so it can be for women and children, it can be for the elderly, and the way that Medicaid eligibility, instead of by diagnosis or age or disability, it goes by your income and your resources. And even though every state does have a Medicaid program, every state's Medicaid program can vary.
Yes.
But unlike Medicaid, Medicare is federally ran, so you're going to see your original parts of Medicare are going to look the same from state to state.
So you said a lot of great things, and not that I'm not listening. So Medicaid is more statewide, and then Medicare is federal.
Yes, so Medicaid's you want to think state ran, and then income and resource guidelines, and then with Medicare, it's a federally supported program.
Yes, so right now we are falling into the Medicare open enrollment period, and this caters to a specific demographic, but it goes all around the country right now, right?
Yes, so Medicare open enrollment, it's actually for every Medicare beneficiary. So the things that you can do during the open enrollment period as a Medicare beneficiary is you can make changes to your Part D coverage. So D stands for your prescription drug coverage, and there's two ways that you can get your prescription drug coverage through Medicare. That's through Medicare Advantage plans and then Medicare prescription drug plans. And both types of these plans are just written for 1 year. So they start in January and they end in December. And that's why we have this open enrollment period, so that you can look at your plan options for the next year. So that's really what open enrollment is for, is to kind of look at next year's options. And Now, even though the plans are written for a year at a time, you can still keep your same plan. It still may be offered the next year. But some things to think about during this time is to check your plan, make sure it's still covering your medications next year, make sure that you can still use your preferred pharmacy. And just like the plans change, Medicare beneficiaries' health needs can change too. So you may be on different medications than you were this time last year, or you may be using a different pharmacy than you were this time last year. So your changes, the plan changes, those are all things to consider when looking at a plan for next year. And since those plans can change from year to year, even if you like your current plan, I always tell folks, well, it's a good practice just to check it. Because even if you like it this year, it could change things like the premium, so how much you're paying a month for your plan, the covered medications, and then what you pay along through the year, like your deductibles and your co-pays and things like that. So even if you like your plan, it's still good to make sure you're going to like it the following year.
Yes, it's kind of like, getting an oil change. You're supposed to get that every few months or maybe twice a year, rule of thumb, but checking your coverage and knowing that whether it stays the same or you want it to be different, just checking in and knowing that it's there.
Absolutely.
So we've talked a lot of terminology and,
I know.
and all of that fun stuff that probably would make the youngsters fall asleep, blah, blah, blah. But where does SHIP come into all of this and all of this Medicare deal?
Yeah.
For people who are new to this, it is a very slippery slope and it can be very frustrating. So where does SHIP come into all this?
Yeah, and that's exactly why we were created, is we're federally supported. Actually, every state has a SHIP program. So we have a lot of support from federal programs, and then also, like I mentioned before, we're supported here in Indiana by the Department of Insurance. And the whole purpose is just like you said, is when you're overwhelmed by all of your options with Medicare and where to start, that's where we can come in. We can be that resource and help those folks kind of navigate through the Medicare waters, so to speak. So the way that our services are provided is we have a small staff, and we're based out of Indianapolis there in the Department of Insurance, but we cover the whole state. And the way we do that is we have a lot of help, and our help comes from our volunteers.
Yes.
So we have about 400 volunteers in the state of Indiana, and we cover all the counties. And our volunteers are trained in all things Medicare. So when they first start, they have kind of a Medicare boot camp, so to speak. And then every year we have 2 update trainings in the spring and the fall, just to kind of keep them up to date on any changes and things that are coming around the corner with Medicare. So our counselors are able to meet with folks one-on-one. And in a SHIP counseling appointment, you can experience help with just knowing your options when you're newly enrolling in Medicare. This time of year, our counselors are very busy.
Yes.
They will sit down with folks and help them with their open enrollment choices. So if you're thinking, oh, I really do need to check my plan for next year, but I don't really know how to do it, or I don't feel comfortable doing it by myself, well, that's exactly what we can help with. We don't make any choices for anyone. We just help them understand their choices, and then hopefully helping them make an informed choice that's going to best suit their healthcare needs for this year. So our SHIP counselors use Medicare.gov. And the reason we use Medicare.gov to help individuals enroll in plans during this time of year is it is the only official government website for Medicare. It's not tied to any insurance companies or brokering agencies. So, sometimes when we go online, we go to a website, we see that little box that says we use cookies and accept all cookies. You're not going to see that on Medicare.gov because there's no soliciting or tracking. Even Medicare.gov has an app. And so it's, that pops up on your iPhone, like ask app not to track. You're not going to see that either because they're not tracking any of your information or collecting that for further calls. So that's a really important thing to understand too as a Medicare beneficiary, because right now they are getting a lot of calls and a lot of solicitations. So as counselors, we don't want to add to that. So we're using the government-funded website for Medicare. And the other reason to use that is all of your plans that are available in your area they have to put their information on there.
Yeah.
So when we use that website to enroll, if the information is wrong on there, then we will be able to correct that, because the insurance companies are supposed to keep that up to date.
Yeah.
So that's another reason that we use that, because we want to give people the most accurate information when they're comparing their plans. So we can walk them through all of that.
So if someone doesn't have a younger tech support individual, like, again, for example, my dad, he's getting up in age, and so
Right.
I provide all the tech support at home. However, if someone doesn't have that as a resource, this is a way for SHIP to be able to help them and walk them through all of this. Not make decisions, not be the executor or anything like that. This
Right.
is just a guide to help further lead them to where they need to be.
Yeah, we just educate and inform them of their options. And like you said, a lot of things with Medicare is going online. So Medicare.gov is a very easy way to compare plans. But for someone that's not used to getting online, sometimes we're just helping them get online and see that. Other appointments, I have folks, they'll come in and they'll say, okay, I think I have it. Will you check my work? You know,
Yes.
So sometimes we'll just kind of double check and see if we see the same thing that they see, which most of the time we do. So, but the other ways that you can check your plans, you can also use, a trusted resource. Like if you have a family member, or if you have an insurance agent that you know and you trust, those are all ways to check your plans as well. The Medicare and You handbook came out that has all the plan information in it as well. Every Medicare beneficiary, one per household. So those came out towards the end of September. And then the other mail that you do want to keep this time of year, and it probably came out at least by the 1st of October, is your plans information.
Yes.
So it's your annual notice of change. If you're currently in a plan, they sent you out information as well. That's another thing that we do, is some folks get that and they don't know what to do with it, and we can just sit down with them and help them understand that.
Yes. So with SHIP, is this service, or is this coming to you and asking for help, is this free to Medicare members?
Oh, absolutely, yes. We are free and impartial and on purpose. So we're a free service.
Again,
yes.
I wanted to reiterate that. People don't turn on the light bulb until they hear the word free. So this is a free service for all that are on Medicare right now.
Yep.
And who want to be on Medicare, correct?
Yes.
So if people want more information about SHIP or anything like that, and they want to maybe reach out to you or maybe ask even more questions, how best is communication? Is just looking on a website? How best can they reach out to SHIP?
Oh, yes, absolutely. So our helpline, our SHIP helpline is 1-800, I'm going to make sure I get it right here, 1-800-452-4800. So that's 452-4800.
Yes, and then if anyone wants the SHIP website, is that still at medicare.in.gov?
It is,
Okay.
yes. So again, we're through the state's programs, so we do have that .gov website. So unlike the Medicare website is medicare.gov, our SHIP website is medicare.in.gov.
See, I wouldn't have known the difference. I just read it off the paper. So good distinction for sure. And
Absolutely.
then is it recommended with you guys to set up an appointment and not just show up so that you can talk things out? I know, again, you mentioned that it's a very busy time of year, right?
Yes, absolutely. So we do recommend that you call and schedule an appointment. You can call or visit our website, and that will lead you to any local counselors and any of our partner organizations, which we call our SHIP sites. So that's where you can go and meet with a SHIP counselor. So you can find that information online on our website or by calling us. And then I have the local resources here as well. So the Jasper Public Library is one of our partners, and we're taking appointments all throughout open enrollment. And I got his permission yesterday to drop his name, but our counselor is Mike Schmidt.
Okay.
And they can call him directly and make an appointment. So I can go ahead and say that
Please,
number.
yes.
And that's 812-567-2027.
And is this, again, you said Jasper Public Library, and of course, thank you to Mr. Schmidt for being able to provide that service.
Absolutely.
Is that for Jasper residents only, or everyone in the vicinity?
Anyone and everyone,
Okay.
Yes.
You have to make the distinction because, again, we have found with anything that we talk about on our Inform program that taking the first step can be very difficult, very scary, and intimidating. So just reach out. If you need help, ask for help. This is what you guys do, and a lot of people do it voluntarily.
Yes, absolutely. So we are right here in Jasper, but we have sites all throughout Indiana. Generations, the Council on Aging, they're one of our big partners as well. So down in Rockport, we have Spencer County Council on Aging. So if you're not in Jasper and you're looking for something a little bit closer, give our helpline a call or visit our website, and we have all of our sites and counselors listed on there as well. But yes, it's for anyone that's interested. A lot of times we'll have beneficiaries bring a family member or a loved one with them that can help them understand too. And what I tell folks is, Medicare can be confusing for a lot of individuals, and really, through most of our adult life, we didn't have to worry about insurance. We had insurance, provided by an employer or maybe through our spouse's employer, and it was just kind of handled. You didn't have a lot of decisions to make. You may have had a few different plan options, but the negotiating and figuring out the insurance was done by someone else. And so then when you enter Medicare, you have a lot of choices to make yourself. And our goal is just to help you understand those choices and to find the plan that best fits you.
SHIP is here to help.
Absolutely.
I cannot stress that enough.
Yes, we are. We are the helpers.
Yes. Well, Melanie, is there anything else we need to touch on today? There is a lot you could always go into.
Absolutely.
But again, that's what the counseling services and being able to talk one-on-one is for.
Absolutely. Well, I'll just summarize. We're free and we're impartial. Medicare open enrollment is started October 15th and it runs until December 7th. So that's your time to pick your plans for next year. The last change you make is the one that goes in effect on January 1st. Give us a call. We're happy to help you, or at least just have someone help you, or look yourself, because it is an important time of year to make sure your coverage is going to be met for next year.
Yes, it is. And again, the SHIP helpline, 1-800-452-4800.
You got it.
So check it out. If you don't want to call, website, all that fun stuff, well, there's a lot, and again, you guys are there to lay it all out and knock them all down, like dominoes per se. But Melanie, we appreciate your time here today.
Thanks for having me. Yes.
Hopefully, no one at home's nodded off. This is important information, and even if it's once a year, it is important to constantly be reminded of. And whatever new changes come, we appreciate you bringing them to the table.
Well, thanks for having me. Happy to be here.
Of course. And thank you so much at home for watching. Again, this has been 18 WJTS in.form with special Medicare and SHIP coverage today. Again, a seasonal topic, but a very important topic nonetheless. And we are local people watching local people.